Namaste.
Namaskar.
Good morning
Good morning to you,
and good evening.
and good evening to you. Actually,
Yes. So, you must all be thinking why I will talk about occupational therapy.
yes,
Before
yes,
that, I wanted to say that occupational therapy is a form of therapy that works with people to help them improve their functional independence of activities of daily living.
true.
Google says that it's a branch of healthcare that helps people of all ages who have physical, sensory, or cognitive problems.
Right.
So, with that note, I would like to welcome Dr. Subrat Mishra to Turiya Talks. Welcome to Turiya Talks, sir.
I really appreciate the offer that you have given me to speak about occupational therapy. I cannot thank enough. This is something I'm really excited to present because in India, occupational therapy is there, but as far as awareness goes about occupational therapy, it's not much compared to US. So I'm glad we are talking about this subject today.
Right. So, to introduce sir is an occupational therapist. He's an administrator in a home health company, in a rural home health agency. He is an entrepreneur as well. We will get to know more about him in this half an hour talk session. So, sir, would you talk about the importance of occupational therapy during these tough times?
Uh, it has a big role, as such, the whole rehabilitation has a big role in the current times right now. One of the major roles that occupational therapy has is, people get sick, they get weak, they cannot function. Function includes like work at home, at work, and doing everyday daily activities. And people don't realize, because of sickness, they cannot even do simple things like putting on their clothes, going to the bathroom, completing their task. They need help. Somebody has to help them. So this whole thing is the rehab is completely together on this, and they will rehab all these people to become independent, what they were doing before, which we call as a prior level of function. So a lot of people are independent because of the sickness of COVID or any other diseases that we know. They cannot function and they cannot perform their activities for every day. And we work on those and we try to take care of them without modifying it, with working with them to make them stronger. If not, we modify and try to make it easier for them so that they can be independent. So occupational therapy has got a vast role in the rehabilitation right now with the current situation going on.
Right, sir. Sir, occupational therapists, they help with barriers that affect a person's emotional, social, and physical needs. Now, how do they do
Yes,
it? We have heard that they make them engage into some everyday activities and exercises, but I would like you to share your views and throw some light on this so that people do understand it very, very minutely.
right. I'll give you an example of a particular situation, and I'll tell you in a very simple way. Suppose a patient has issues with uh, like autism with the children specifically. I'm going to give you these kids have social barriers like you cannot even imagine. They cannot function on a social gathering or social big society out there. So that's a big social barrier for them, and OT works with them in the clinic with the parents and make them teach alternative ways how they can modify their behavior so that continuous stimulation of this social social activities that can bother them, they cannot function. So we try to desensitize all that and make them as normal as possible so that they can mix with the society. Now that is one small example. Now with a lot of cumulative traumas and different uh, disabilities, they have a lot of mental barriers. They think they can never get well, they can never function, they cannot never go back to work, they can never do their activities. So OT works with them, teaching them to do alternative ways, how they can complete all that, all their daily activities or their work where they want to go back to work. So work with them, strengthen them and make them mentally very strong and make them confident that they can go back to work with what they were doing. So we work on that too. That's a small example of social and mental barriers right there. Emotional wise, there's a lot of depression associated with this. A lot of people get sick and they get depressed. So we work with them and we show them they can do this, and they get so excited that they can actually perform some activities which they thought they could never do it. So we work on that, and that helps them really on the depression side. They get very excited, and then they start doing more that they can function for every day. So basically, this has a very vast role that not a lot of people don't understand, and they don't want to. We usually think if we are sick, we just take a medicine and that'll be taken care. You will be fine. That's not the way thing works. Medicine can cure you from the illness maybe, but not from everyday tasks that you cannot do, your weakness, your mental ability, your social barriers. We work on all that. Like stroke patients is a big example. We work with stroke patients to be completely independent, and they can go back to what they were doing before.
Right, sir. So my next question would be, or rather, people would be asking, what ages and diagnosis do occupational therapists work with basically?
Okay, like I said, we start right from birth, 0 to 1 year. There's a lot of kids that are born with developmental delays, cerebral palsy, and all those patients. We work with them too, and that like their milestones they cannot achieve. So we start working with them in a very early way. It's called early intervention, that we work with the patients. Now we work for the kids, like I said, with autism, cerebral palsy, different other issues. Uh, we work with the kids to about 1 to 14 years of age with all different traumas. And then we work also with the seniors. Seniors is a big one, like about 50 years of age. In between, we work with industries, like between 20 to 45 years of age. We work in industrial rehab too. A lot of occupational injuries happen, industrial setup. So OTs work with them, especially with upper hand functions and upper extremity disabilities. And for that, OTs also do in the industry. They do this. What they do is a modification, which is called ergonomics, which is a big area that OTs can do too. Where what they do is modify the setup of the industry so that they don't have work injuries. So we work on that too. So basically, we work from 0 to the entire population. It is not specified to one particular group. But yes, occupational therapists are very specialized in children, sometimes with the seniors, sometimes with the outpatient setup, where they treat more diseases, conditions. So a lot of people go into different niches, whatever they want to do.
Right. Sir, occupational therapy is one such healthcare profession that has become popular in recent times. So what are your views on it?
Um, I think what it is occupational therapy first started in the World War time. It was invented. So it's basically a very new profession, and it was mainly started during the war when the soldiers were injured and they started treating them to make them independent. So from that time onwards, it became a very popular in England and in United States during the wartime. And so it started back not very long ago, 40s, 1940s, 30s, in time. So slowly it has regained its momentum back. Physical therapy was there for a long time. So nobody knew the difference till all this started. And then slowly India started having occupational therapy schools, started on the rehabilitation setup. So in last 20 years, I think we have progressed quite a bit from what we were. It was not a very recognized profession before. Now, no, and now almost over here in the United States and everywhere, they know this is a part of rehabilitation. OT becomes a part of rehabilitation for sure. So, so slowly
I
we're getting awareness, and I'm very thankful that you are actually through your Turiya Talks, you'll be able to spread this to the community, that what OT can do and what OT has a big role in the recent times. And I'm very very obliged that very very
right.
thankful that you are doing this.
Rather, we are obliged to you. I think developing nations always follow the protocols and ideas being experimented by developed nations.
Right.
So I am happy if the administration and system in developing nations like Africa and India, they do understand the importance of occupational therapy, and
Yes.
we have more occupational therapists going forward. But before that, I wanted to understand what are the few necessary skills for success in occupational therapy. Can a doctor, can a nurse adapt this? There is something called upskilling. So, if you can throw some light.
Okay. Uh, Now this is a complete big topic actually. Uh, I think occupational therapist needs to go to school in order to do it. It's a 4-year training process, and a nurse, like I said, nurse goes to school, but they're not trained for occupational therapy. So my point of view is anybody who wants to practice as an occupational therapist needs to go to school. It's in India, they have a lot of occupational therapy programs available now. From the time I was there, I graduated from India, from Calcutta. We had only like 4 or 5 schools. Now they have at least 20, 25 schools throughout India. So my point on this is anybody who wants to practice occupational therapy needs to go for occupational therapy school and become a graduate. Now, the entry level for occupational therapy practice now has become master's and doctorate. So that's now that changes everywhere. Like in order to come to the United States to practice occupational therapy, you have to have almost a master's now. That's like an entry level. The same thing India and other countries have adopted too. So they have started programming, have the programs adopted to according to how they are doing it over here. Previously, we used to have 3 years of bachelor's and 2 years of master's. So now they've combined into 4 years of master's direct program. So, so anyway, so the basic thing is to train. Now, over here we have occupational therapists and occupational therapy assistants. Now, the assistants is a 2-year program that they go to school for 2 years, learn everything about occupational therapy. The only difference with them and us is they cannot do evaluations. We can do the evaluations and the treatment plans, and they have to follow our guidelines. So they'll be supervised by us. So that's the difference. They can do certain things. Now, like you said, for the nurses who think they can do that part, they probably can, because we teach the community a lot, patients a lot to do certain things, but not everything. Now over here they cannot, because it's a highly regulated regulated profession. So if they do that, there are legal consequences for that. So I would highly suggest people who are interested to study this, please go to the school. It's not a difficult sub profession to get into. Anybody who's pretty even 50% smarter or 80% smarter, they can be able to complete this. And it is a very big thing. I think this will be a big profession. It will help a huge contribution to the society in future.
Right, sir. Uh, have I missed out any question? But I think since you are into healthcare from last so many years, I think
Yes,
I have to ask you one question.
sure.
What difference do you feel between the healthcare system in the 90s and now in 2001 and then 2021? So you have seen decades and decades.
Decades, yes. Um, there is a big change in how we are providing care nowadays. The biggest change, I would say, has evolved on computers, you know, getting information sooner, faster, easy accessibility to different materials. Uh, the basic concept of treatment has also changed because we have come up with more equipments that we use in therapy that were not easily accessible before. A lot of companies have come up and have seen, how we are working with the occupational therapy. They have provided us with various resources and materials. Uh, I think in the past 20 years, I would say, the biggest change that has come is for autism for the children, because it has been a huge issue, which was underdiagnosed before, and it has come a big way, uh, where therapy has a big role in art. I'm sorry.
Right, sir.
Okay. So therapy has a big role in all these kids that are going through this crisis. Now, nobody talks about autism much, but I know people, it's like a social taboo now. A lot of people don't say they have all these issues. We have seen so many children with this autism problem recently, and I'm glad that, the therapies have come forward with all the treatment goals, with the treatment, approaches for the kids, and it is giving them a very big ray of hope, which was not there before. Now, we used to work with other types of children's before, like with cerebral palsy and all. That was such a big thing to work with in India, where I worked down there. But autism is something new, and slowly government has opened up over here about the resources and the treatment, how we can do it, so that they can be, you know, t- taken back to the society and function as one person instead of, always
Right,
being dependent on somebody. So yeah, that's a big
sir.
change.
Your yeah. Any final message for Turiya Talks and Turiya Communications?
Well, I would say you guys are doing an excellent job on, communicating with the public and with different professions about other professions. And this is a very noble approach that you have taken. And I think a lot of people will benefit from this who are hearing this, and also from the professions, the other professions, they're hearing about this, and, will always be thankful to you for
Right,
spreading this out. So I wish it
right,
very good, and I think you guys will flourish like any other channels, and I wish to see you as a big platform in India and over in
right,
the
sir.
world maybe, and I wish it from all my heart.
Right. So, with that note, we can wrap up the show. And I
Sure,
think people must have understood the importance of occupational therapy.
sure,
Every problem has a solution. And the way we say that marketing agencies like us, we have to know the science and art behind anything we do. So in the similar fashion, when people face issues, it's not that just they have to go to the doctor, but sometimes they have to consult an occupational therapist also. You can Google, and in case you want to get in touch with Subrat sir, you can reach out to him directly, or you can get connected with Turiya Talks. We can help you out, and that's it from my side. I hope viewers understood the importance of it, and this was a very, very knowledgeable session. Thank you. See you all in the next session of Turiya Talks. Till then, be safe and happy. But please do not forget to like your own Turiya Talks. Do subscribe and do comment also. Let us know what kind of session you want to have so that we can plan and invite guests accordingly. Till then, thank you and namaste.
Namaskar. Thank you so much.